Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what pseudoseizures are, pseudoseizures versus conversion disorder, the origin of pseudoseizures, diagnosis, and treatment. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. Pseudoseizures are one of the manifestations of conversion disorder, a psychiatric condition in which a patient experiences neurological symptoms such as paralysis without an actual cause. Conversion disorder usually occurs after a highly stressful or traumatic event. Pseudoseizures often reflect an individual's knowledge of seizures. Many tend to mimic the stereotypic generalized tonic-clonic seizures. They are often characterized by violent flailing, whereas generalized tonic-clonic seizures tend to display jerky movements. People with pseudoseizures may yell, cry, or swear during an episode. They may also be unresponsive or have a loss of consciousness. Many are conscious during the episode and will close their eyes, whereas the eyes are normally open during a seizure. In the article, Pseudoseizures and Dissociative Disorders, a Common Mechanism Involving Traumatic Experiences, patients with psychogenic non-epileptic seizures or pseudoseizures have been diagnosed as having conversion disorder or dissociative disorder. Pseudoseizure patients frequently report a history of physical and sexual abuse, and traumatic experience is considered part of the mechanism for producing dissociation. Physicians now refer to pseudoseizures as psychogenic non-epileptic seizures. According to the article, Psychogenic Non-Epileptic Seizures, psychogenic non-epileptic seizures resemble epileptic seizures, but without excessive synchronous cortical electroencephalographic activity that defines epileptic seizures. According to Children's Hospital of Philadelphia, conversion disorder is a condition in which a person experiences physical and sensory problems such as paralysis, numbness, blindness, deafness, or seizures with no underlying neurologic pathology. Approximately 85% of patients experiencing pseudoseizures report past trauma. Military combat, sudden loss of a loved one, physical and sexual abuse are commonly reported. There is a strong association between pseudoseizures and dissociative disorders, such as dissociative identity disorder and post-traumatic stress disorder. 90% of patients with pseudoseizures in a study were found to meet the criteria for a dissociative disorder, according to the Diagnostic and Statistical Manual for Mental Disorders, 4th edition. Psychiatrists believe that pseudoseizures may be a mechanism for patients to dissociate when they encounter a trigger and start to experience unconscious negative emotions and flashbacks from their trauma. Testing is conducted when a neurologist is suspecting that a patient's seizure-like activity is not the result of epilepsy. If seizure-like activity lasts for more than 2 minutes, the person is conscious while seizing, crying, yelling, making random movements, lack of a postictal state, which is post-seizure state, confusion or tiredness, and avoidance of painful stimuli are all signs that the patient is experiencing pseudoseizures. Video-EEGs that show normal brain activity, but the video shows the patient physically exhibiting seizure-like activity. It is likely they have pseudoseizures. Because pseudoseizures may occur spontaneously, some physicians attempt to induce them using lights, placebo injections, and sleep deprivation. Pseudoseizures are treated by psychiatrists, not neurologists. Psychotherapy is used for treatment. The psychiatrist may guide the patient to describe traumatic experiences in their life, learn how to recognize and communicate their emotions, and understand the basis of their disorder. Psychiatrists may also treat coexisting mental illnesses such as depression and anxiety with antidepressants, anti-anxiety medications, and cognitive behavioral therapy. For patients who are experiencing stress due to relationships, marriage or family therapy may be recommended as well. With appropriate treatment, most patients will make a full recovery. In conclusion, pseudoseizures are one of the manifestations of conversion disorder, a psychiatric condition in which a patient experiences neurological symptoms such as paralysis without an actual cause. Physicians now refer to pseudoseizures as psychogenic non-epileptic seizures. According to the article, Psychogenic Non-Epileptic Seizures, psychogenic non-epileptic seizures resemble epileptic seizures, but without the excessive synchronous cortical electroencephalographic activity that defines epileptic seizures. Psychotherapy is used for treatment. The psychiatrist may guide patients to describe traumatic experiences in their life, learn how to recognize and communicate their emotions, and understand the basis of their disorder. To learn more about pseudoseizures, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.